According to the American Psychiatric Association, autism spectrum disorder, or ASD, is a variation of deficits ranging from social, emotional, to developmental deficiencies. This research will consider college students with high-functioning autism spectrum disorder, and the research will question, can service animals be an effective method of treatment for college students with ASD? According to White et al., the number of individuals diagnosed with autism spectrum disorder is increasing. It has also been determined that the number of students with ASD who are attempting or completing their post-secondary education is diminishing. Therefore, educational systems must find creative ways to improve their diminishing success rates, furthering the justification for additional studies. Current research in this area has mixed results due to the varied symptoms of this population. There seems to be no clear-cut and definitive method to ease the symptoms for college students with ASD. Colleges and universities need more appropriate combinations to suit these individuals' needs, and more studies are needed to find methods to better serve college students with ASD. Research found focuses on themes such as depression and anxiety, as those are the general symptoms. Gaps in research determine the need for more studies and support recommendations. This research will hypothesize that service animals, the independent variable, will benefit college students with ASD by alleviating their symptoms, which is the dependent variable. The null hypothesis will state that there is no positive correlation between service animals and an improvement in symptoms in college students with ASD. Considering that this study will be conducted in the field with the utilization of surveys to acquire the data, a quasi-experimental with a time series design study will be used. The researcher will manipulate the independent variable after such a time that the counselor has administered one or more surveys to determine the participant's symptom baseline. The study will utilize a correlational design to analyze the data before and after induction of the independent variable. Due to the descriptive field study setting, the researcher has no control of the external environment in which the participant occupies. Thus, the data acquired in the study will be situational and highly subjective. The participants must have a diagnosis of ASD and be a current college student. They must also carry symptoms of depression and anxiety and be seeing a counselor. Lastly, they must also be able to care and manage for a therapy animal. Because of the descriptive field design, this research has high external validity and low internal validity. Therefore, input by the participants and feedback by their counselor is required and necessary. To gain insight into the progression of the participants, this study will utilize the Depression Anxiety Stress Scale, or DASS. The DASS-21, a shortened version, was chosen specifically for this study and population for its easy-to-answer questions that can be scaled quickly and in a short amount of time. The DASS-21 will be used before, during, and after the research period on a weekly basis. The study will use a correlational design to analyze the data collected by the participant's counselor. Due to the scaled survey, interval data will be generated to determine the difference, if any, after the independent variable has been placed. Once the data has been analyzed, the researcher will be able to determine if there is a valid and reliable correlation between the utilization of service animals and a reduction in symptoms of ASD. Professionals working with individuals with ASD rely on empirical research to determine appropriate methods and treatments to use with their clients. To establish positive development in post-secondary academic success, counselors can use creative methods to benefit their clients and work toward collaborating with colleges and universities to provide appropriate accommodations for their clients. This research will enhance the professionals working with individuals with ASD and, in doing so, will be able to provide them a higher quality of care by utilizing relevant and substantial methods and treatments.